Hi guys, and welcome back to my channel. If you are new here, my name is Keita. Welcome. Make sure that you hit that subscribe button down below and hit that post notification bell so that you never miss another upload from me. Alright guys, we are going to jump right into my grades for the first semester of respiratory therapy school. I have made you guys wait and created so much suspense about what my grades and things were. So yeah, let's jump right on into Canvas and check this out. Alright, so right here we got RTH 101 Fall 2020, and I'm just going to jump in there and go to my grades. In this class, I got an 87.44, and we were required to create a student account with the AARC so we could actually gain credits for when we do graduate with the AARC. So in this class, we had 3 tests and 4 quizzes. And we also had, these are all my grades, y'all. I'm going too fast, ain't I? My bad. But we also had some medical terminology to do. So I'm just going to click on one of these right here so you all can see what all we did. So this is going to take me to another tool that we used. And it's going to bring up our actual medical terminology that we used. So this right here is our book online, which is the Exploring Medical Language. And we just had, this chapter is chapter 5, Respiratory System and Introduction to Diagnostic Procedures and Tests. So we just had like 10 medical terminology questions for each chapter. And we just had to go through and answer the questions accordingly and then hit submit. And we had like disease and disorder, surgical terms, diagnostic terms, and complementary terms for this. So we had 4 for each, or either 6 or 7 for each chapter, but we got it done. Yes, so that's how all of these chapters were done. But all of these medical terminology self-assessments were not 5 or 6 per chapter. Say like one of them could have just been 1 for our self-assessment medical terminology. And then we also had our comprehensive exam. So comprehensive is just like everything that we have learned throughout this semester. And RTH 101 was the integrated science for respiratory care, and I got an 87.44 in this class. So let's jump out of here, and we're going to go to RTH 121, in which I got a 90.9. I'm just going to click on grades. And this class was our cardiopulmonary class. And we also had self-assessments in this class. However, our self-assessments for this one was different than integrated. Like integrated was a lot of history and math and formulas and things like that. This self-assessment here was different. Like our professor asked us clinical presentation questions. It was things like, okay, your patient presented to the ED with right lower lobe consolidation, egophony on the right, tracheal shift, like things like that. That's how these self-assessment questions were. And we had 5 quizzes in this class. We also had to learn each segment of the lung. That's what that lung segment quiz is. Our professor actually held up our lung model for our class, and she pointed to the actual lobe or the segment of the lung, and she pointed to it, and we were supposed to answer it and spell in the account, y'all. And I was like, what? But anyway, we also had 3 tests in this class, but she gave us an extra test. So we had 4 tests in this class. And then we also had a presentation in this class. Our presentation, well, me and my group's presentation was pneumonia. It was me and 2 other people. So 3 people in my group, and then other groups had like 2 people in their group. And we did presentations on anything from pneumonia to cystic fibrosis, bronchiectasis, neuromuscular diseases, COPD, asthma, things like that. So yeah, it was like we did a lot of function in this class, like how the heart worked. We had to know the flow of blood through the heart, as well as a lot of formulas, lung compliance, total lung compliance. Like we had to know the minute ventilation, tidal volume, stuff like that. So this was really application class. Like you really had to understand it and apply it, because that's the only way that you would have been able to do the actual self-assessment that's listed here. But we had to know like what was associated with congestive heart failure, asthma, like stuff like pink frothy mucus, and like this was an awesome class. Like I learned so much in my first semester, you guys. Oh my God. But I got a 90.9 in that. So let's run on over here to RTH 190. I got a 96.45 in this class. And this was our clinicals, where we went to the hospital from like 6:45 in the morning to 3:15 in the afternoon, or 6:45 in the morning to like 10:45 in the morning. So it just depends on what rotation that you was on. And we also had night clinicals as well. We started at 2:45 to 11:15. So whatever we did in clinicals, we were graded on it. Like if we had a patient and he had to have incentive spirometry or a breathing treatment, we were able to do the things that we were checked off on lab, because our program uses a software called Trajexis, and it keeps up with everything that we did, what we saw. It even what's the word I'm looking for? It also kept up with our interaction with physicians, and if we were able to learn from them, and we were actually able to evaluate them as well. So we did a lot. We seen a lot, and I'm just thankful that I was able to learn from who I learned from and be in the class that I'm in, because I tell you what, y'all, my classmates are the bomb.com, and I love them to death. So if you have any questions, please feel free to reach out to me. Email me. I don't care. I'll email you back as soon as I see it. But second semester does start Monday, January the 11th. So yeah, I will see you guys in my next video. Thank you guys for watching.